Blair Cushing, here testifying for herself for the bill.
Good afternoon. My name is Blair Cushing. I'm currently a fourth-year medical student at the University of North Texas Health Science Center in Fort Worth. My intention is to enter a residency in family practice. I found out on Monday that I matched, and we'll find out on Friday where I'm going. As part of that family practice, I do intend to do full-scope family medicine, so serving people across the age spectrum from birth until death. And I have particular interest in working with adolescents. So you all have already heard a great deal, many times over, that Texas is the state in the nation with the highest rate of repeat teen pregnancies. As a statistic, that means greater than 1 in 5 of the teen pregnancies in Texas happens to be a repeat teen pregnancy. From a medical perspective, the reason that we're quite concerned about these repeat teen pregnancies is because of the known poor health outcomes that tend to be associated with repeat teen pregnancies. In large part, that has to do with the spacing of pregnancies being inadequate. From the science standpoint, unfortunately, it's very difficult to perform medical research on pregnant women for lots of obvious reasons. People would not want to consent to be experimented upon. So a lot of our data is things that we're looking at retrospectively. But sort of the leading hypothesis seems to be one wherein essentially it's saying that if you don't adequately space your pregnancies, your body's basically not ready, not prepared to be able to handle a subsequent pregnancy. So the rates of birth defects increase, the rates of premature labors increase, the rates of low birth weight babies increase, even the rates of autism are known to increase. So there's lots of different health outcomes for the children as well as the mother that we look at in terms of why we would not want a teenager to be pregnant multiple times over and carry that child to term. So from my personal perspective, the very first time that I ever told a patient that she was pregnant, it happened to be a teenager. It was a 17-year-old girl. It was at a JPS Health clinic in Tarrant County, and I had a very long conversation with her about what had happened, what was going on in her life, and her biggest fear was that her mother would be very disappointed in her. And those were the words she just kept saying over and over again. She had an older sister who was 20 years old at the time, who had become pregnant as a teenager, and basically never followed through on her dreams, didn't graduate from high school, never went on to college. This particular teenager was a senior in high school, and she had intention to go on to college. And when we talked about had she considered using any form of birth control, she mentioned that she didn't really have access to it and she didn't feel comfortable asking her mom, again, because she felt that her mother would be incredibly disappointed in her. So it had nothing to do with the capacity of this particular young girl. She absolutely understood what measures she could take to try and protect herself, but she didn't feel that those measures were available to her. I have another particular patient who will forever stand out in my mind, who was a 14-year-old girl, and I met her at a family planning clinic in Dallas, and she came in with her mother, and her mother had taken her and her younger sister to go and get on birth control because their older sister, who was 18 years old, was found to be pregnant. So at the time that this 14-year-old were able to identify her pregnancy, she was already 20 weeks along, so she was quite far advanced in gestational age. And similarly, she was very much at odds with her mother about what she wanted to do with the pregnancy. She wanted to continue the pregnancy and co-parent with her boyfriend, and the mother had very strong feelings that that wasn't going to work out for her. But again, when asked about contraceptive options, she said, I didn't really know how to go about doing that, and I didn't feel like I could ask my mother. So these are teenagers who want to be responsible and they want to do the right things, but they don't feel that they have those options available to them, or they feel so afraid of disappointing their parents or what it's going to mean to their parents if they were to approach them and say, hey, I would like to get on birth control of some sort, that they never end up doing it. Again, as a medical provider, what I have noticed in my past few years of clinical experience is that the best time to prevent a subsequent pregnancy for any woman, whether she's 15 or 35, is immediately after she gives birth. And unfortunately, also from what I have seen in practice, is that far too often we are discharging women from the hospital without having that conversation. Now, when it comes to a teenager who's under the age of 18 and is not able to consent for herself when it comes to birth control, despite the fact that she has been able to individually determine every step along the way how I will care for her throughout the prenatal course and what will happen during the course of her delivery, and then what will happen to her baby, and whether or not we do immunizations and circumcisions, and if there's any surgery that needs to be performed, that's all within this teen mother's ability Yet she cannot determine for herself whether or not I give her contraception to prevent subsequent pregnancy. Now, in my mind, because of what we know about the potential risks both to the mother and to the child of inadequately spaced and repeat teen pregnancies, is that it absolutely does have an effect on her existing child. That her ability to raise that existing child can be impacted by her becoming pregnant again through an undesired and unplanned pregnancy. So, unfortunately, during our discharge meeting, before I sent her home from the hospital that day, if her parent or guardian is not present, I can't make sure that she's going home with a contraceptive plan. So even though I know that it is medically best, and that for any woman I would love to be able to do that for her, in this particular teenage patient's situation, I'm not able to. So, as a future medical provider, I absolutely believe that it's imperative for us to be able to trust our patients. If we can say that we trust this woman enough to take care of her own child, that we need to trust her to be able to make her own reproductive decisions about trying to not become pregnant again in the future. One last thing that I would like to add, because I think it's something that a lot of people don't understand, is about subsequent access to birth control. So if I'm not able to provide access to contraception prior to discharging someone from the hospital who's just given birth to a child, most women, about 56-57% of the women in this state, last I checked, are delivering on Medicaid. A very large percentage of those women are on emergency Medicaid, which means that they only have coverage for 2 months after delivery, which basically includes 1 6-week out postpartum visit. And then after that, she doesn't have insurance anymore. So if I'm not able to get her access to contraception at that visit, I can't guarantee that she's going to be able to get it again. With a teenage patient, our CHIP program in Texas specifically excludes coverage for contraception for the purpose of preventing pregnancy. So even if she's otherwise covered by CHIP on her own, she still can't access contraception. So we're very, very limited in our ability of when we can actually get access for these young women, and I believe that we need to do everything we can to try and address this problem when we have the ability to do so. And I'd be happy to answer any questions.
Thank you for being here. So you're just about through, huh?
Yes.
Good for you.
Yeah, five more weeks of graduation requirements and I'm done.
Right. Well, thank you for being here for your testimony. Yes.
How was your experience at North Texas Health Science Center?
It was excellent.
Good. Well, I represent this.
I know that.
Thank you for coming down here today.
Thank you.
Appreciate it. Thank you for being here. Okay, at this time, the chair is going to call Peggy Martin, Texas Unitarian Universalist Justice Ministry Board member, and herself testifying for the bill.